My name is Khumo Mngomezulu, and I'm currently working with the HSRC as a research assistant for the division of the PHSB. This policy brief is just for my observation of the increasing numbers of people that are living with diabetes. And with the diabetes diagnosis, it usually requires a lot of lifestyle changes from the person being diagnosed, ranging from their diet intake, their physical activities, and even adjustments in their salt intake. There seems to be no alignment of policies that speak to fruit and vegetable consumption, and also policies that speak to the issue of food production in general. So then the ripple effects of that is that for someone that is living with diabetes, they might find themselves that they go to the doctor and they're advised to take this grouping of fruit and vegetables. However, they are not freely available to them, which can range from the income that comes into their household, the affordability, or it could even be cases of the type of climate that they are living in, that they cannot even grow those fruit and crops for themselves. So we need the policies to speak to one another, and we also need the localization of our national policies, because these policies are formulated at national level and then they have to be implemented provisionally and then community-wise. So we need to find a way that these national policies are speaking to specific communities in our country. The way that the policy landscape needs to change is that when you look at the management of diabetes, it requires a lot of stakeholders, several stakeholders, that when they work together, then we are helping the person that is living with diabetes. So what needs to change is that the Department of Health, advice like going to the clinic and be advised by a healthcare provider that you should adjust your diet in this way and that way. There should be a way where the healthcare provider and the officials that work in the Department of Agriculture, Land Reform, meet, so that they know that in these communities this is the prevailing NCD, and if we work together, this is how we can meet the needs of our community. We can direct them to our policy brief that I just spoke about now, that within the HSRC system, but we've also published a research article. The research article was looking at the gendered consumption of fruit and vegetable consumption through the Agenda Journal. I think it's Taylor and Francis publication.